Morning is the 2023 World AIDS Day. We know that every 1st of December we commemorate this day. It's a day that we create awareness and also understand the challenges people that are living with HIV AIDS are passing through, and also talk to people about so many things they need to know, stigmatization, and then people that are still negative, how they will keep on testing themselves and know for them to be sure of their status, and many more. So today we have as guest with us in the studio, John Bosco Ementa. He is the Executive Director, Anambra State AIDS Control Agency, ANSACA. Glad to have you on the show once again.
Thank you.
All right, you're welcome. But before we go ahead with our discussion this morning, we are going to bring a background from DEFCON on World AIDS Day. And after that, when we come back, we'll start with our discussion in the studio. My name is Chidimma Oranwan, of course.
I'm Ajuluchuku Okabwe, saying sit back, relax, and enjoy.
Okay, so let's go for the background. We'll be back. Stay with us.
Today is World AIDS Day. World AIDS Day, observed on December 1 each year, is an opportunity for people worldwide to unite in the fight against HIV, show their support for those living with HIV, and commemorate those who had died from AIDS-related illnesses. The day also aims to raise awareness about the importance of HIV prevention, treatment, and care. As the world marks the 35th Annual World AIDS Day on December 1, 2023, DEFCON's call on all stakeholders to renew their commitment to the global fight against HIV/AIDS and stand united in the pursuit of ending the epidemic within Nigeria's borders. Themed, Let Communities Lead. This year's World AIDS Day serves as a poignant reminder of the urgent need to address health disparities and work collectively to achieve the ambitious targets set forth by the Joint United Nations Programme on HIV/AIDS, UNAIDS. In the late 1990s and 2000s, Nigeria, recognizing the gravity of the HIV/AIDS challenge, intensified its effort to curb the spread of the disease, enhance access to treatment, and eliminate stigma and discrimination associated with the disease. These entails initiatives of the Nigerian government in collaboration with various stakeholders on 1. Increased testing and awareness. The government should continuously scale up HIV testing and counseling services to reach more communities, emphasizing the importance of early detection and treatment. 2. Accessible treatment. While there is commitment to ensuring that everyone living with HIV has access to life-saving antiretroviral therapy, AIT, there is need for increased efforts to expand treatment centers and improve the availability of essential medications. Prevention programs. Continuous investment in comprehensive prevention programs, including education campaigns, distribution of condoms, and support for high-risk populations to reduce the number of new HIV infections is of utmost importance, especially among the young generation of Nigerians, the Gen Z, and others. 4. Community engagement. Recognizing the crucial role of communities in the fight against HIV/AIDS, involvement of communities, civil society organizations, CSOs, academia, faith-based organizations, FBOs, and non-governmental organizations, NGOs, in the design and implementation of HIV/AIDS programs should continue. 5. Combating stigma. The country should not relent in efforts to eliminate discrimination and stigmatization associated with HIV/AIDS, dispelling myths and misconceptions with continuous public awareness campaigns to promote understanding and empathy towards those infected and affected by the virus. In commemorating this year's World AIDS Day, government officials, healthcare professionals, development partners, activists, and citizens should come together to participate in various events, including seminars, workshops, and awareness walks across the country. DEFCON aligns with the Program Coordinator for Henry Jackson Foundation Medical Research Institute, FJFMRI, Dushima Ogandan, who stated that it is important to focus on the key and vulnerable populations in the country, and communication must begin to target these vulnerable groups. We urge all Nigerians to join hands in creating an inclusive and supportive environment for those affected by HIV/AIDS, emphasizing the importance of unity in the fight against this global health challenge. Mrs. Omobonike Adebayo, DEFCON's Programs Officer Communication, calls on all stakeholders to stand resolute in their commitment to achieving the UNAIDS targets while ensuring a future free from the burden of HIV/AIDS for all citizens with targeted inclusiveness, and to ensure that all individuals and families are covered wherever their locations are.
Bosco Ementa with us in the studio this morning to talk about this a day, that is the 2023 World AIDS Day. From that background that we just listened to now, we talk about a whole lot of areas that we need to focus on. And one out of it is increasing testing and awareness, which is the most important thing that we need to do. So we want to understand now, today is 2023 World AIDS Day, what you have been doing and what you intend to do as an organization in Anambra State, ANSACA in Anambra State, to see that we create more awareness for people to understand that, yes, HIV/AIDS is still with us, but then again, they need, or we need to get tested, and how to go about it.
Okay. Thank you. Let me start by thanking you, the media, and the critical stakeholders that are helping us, collaborating with the agency and the relevant organizations for us to achieve our goal of ending AIDS by the year 2030. The Anambra State AIDS Control Agency, which is the agency charged with the multi-sectoral coordination of all HIV sector response, both health sector and non-health sector response. And I only want to appreciate DEFCON for partnering with us as a critical stakeholder in Anambra State. And for us, HIV is here with us, and we are doing a lot to see that it's tamed so that we can stop more people from getting infected. And today, being the 1st of December 2023, it has been it's our tradition to celebrate and commemorate in remembrance of those who have lost their lives on account of HIV/AIDS. And what is the opportunity to sensitize our people that HIV is still with us and it's not a death sentence. It's a disease that can be contracted via blood fluid, via unprotected sex, mother-to-child transmission of HIV, through using of sharp objects, and equally through on-screen blood, during blood transfusion. So it's a big opportunity for us, but for us to achieve our target, we need to stick strictly with the global UN AIDS target of the first 95 of getting the 95% of people who are living with HIV for them to know their status, which is the first target. And that first 95 is what we are hammering today, because the number out there is quite much, and we need to get them. And how do we do that? Because it's through only HIV testing that one can know his status, or his or her status. So we are just like we've heard from DEFCON, which is a critical stakeholder to the agency. We are preaching and sensitizing people to go out there and know their test and know their status, because it's only through doing this test that you can truly know your status. And we've had over the years, we have other testing methods using determine HIV testing algorithm, but to complement that effort and removing barriers associated with stigma and discrimination, there's now a new innovative testing approach, what we call HIV self-test. And with that one can confidently test his or herself without involving anybody, cutting the issues around stigma and discrimination. It's a very convenient way of doing HIV tests. So for us, it's a very good strategy, and we want our people to go out and make use of the opportunity and know their status, so that at the end of the day, we can see that we've got that number and reduce the rate of transmission. And the test, just like I said, it comes in various forms. We have the one we call HIV self-test, which is with oral quick. This one is oral quick. It's an oral quick. It's a oral. You need to open it and swab it around your gum. It's very convenient. It doesn't hurt you in any way. On your own, you can do it, and the instructions are very, 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 very detailed. Anyone can understand it easily once you open it. And we probably have the blood-based. You can see Mylan HIV self-test. This one is a blood-based. This one, you can use a lancet to just prick and get your blood and do it on your own. Very convenient. You don't need a third party or second party to do this. So it's what we are preaching. And for us, the agency, we have in partnership, in collaboration with NACA, National Agency for the Control of AIDS in Nigeria.
Okay.
We've mapped about 100 pharmacies and patent and proprietary medicine vendors in Anambra State. We've trained them on this HIV self-test, on how to go about data and monitoring and evaluation to ensure that people who come to the facilities get this test at a very affordable price. All throughout Anambra State, we have some selected pharmacies. So we are equally going to scale it up by next year so that more pharmacies and more medicine vendors can key into it and make it more available. And it's equally in our facilities around through Anambra State.
Okay.
Yeah. Thank you.
John Bosco, let me just add a little bit. I think the moment stigmatization can be arrested or brought down to the barest minimum, I think there will be an increase in people volunteering to come and run this test. Now, what is your organization, ANSECA, doing in order to step down on stigmatization?
Okay. Just like I said before, HIV, the perception that was given to it when it came on board was a wrong one. As if it's a death sentence and it only can be contacted through sexual means or sexual intercourse. But it's not so. You've seen some healthcare personnel offering service and got this infection. So it's not only through that means. So we frown, with agency and all the stakeholders, government of Nigeria frowns at those who are stigmatizing people on account of their HIV status.
Is there any stiff punishment for that?
Of course. There's an act of National Assembly 2014 and which has been in existence. Even though that we are making effort by agency, we've called on some stakeholders and we've engaged and equally submitted the state own to the State House of Assembly. And we are hoping that with the collaboration we are having with the current speaker and the current assembly, we are sure that they are going to pass it into law to see it domesticated in Anambra State.
So that no person living with HIV can be discriminated once qualified for a job.
Of course. We are getting some cases being reported because now we have a gender human rights response team in the state, which comprises of SACA as my agency as the chairman. We have Minister of Health, SASCAP. We probably have NDLEA, we probably have Police Action Committee on AIDS, we probably have Civil Defense, we probably have Minister of Justice, we probably have NEP1, Network of People Living with HIV, we probably have Association of Positive Youth, Young Ones, Association of Women Living with HIV, ASHWAN, and all that, anyone without any organization, even Minister of Women Affairs, all the critical stakeholders that work in the area of gender are equally part of that team to enable us walk around and see that anywhere issues are coming, we tackle it as a team. And we probably have a hotline, and even NACA free toll line, 6222, 6322, so the one can reach us out on account of this. If you are right, it's being violated on account of your living with HIV. Yeah. So we are working, and even the agents, we have a number you can call. People have been calling and their cases have been addressed.
Okay. All right. We understand that as of now we don't have any cure for HIV/AIDS in the world, anywhere in the world. But I know it can be managed, and there are drugs that we take, especially for those people that are already tested positive. Drugs that they can take to help reduce their viral load. Now the question is, we want to know, because we've talked about increasing awareness for people to get tested. Then after testing and you are now positive, how do you access facilities where you can get these drugs, antiretroviral drugs? Okay.
Just like I said, the HIV self-test. HIV self-test is not a final stage in testing.
Okay.
If you test it, if you use it and it appears that it's positive because the instructions are there, you need to go to our facilities. We have about 1,182 facilities in Anambra State. This is just to help us increase testing, increase provision of HIV services to our people, so that we can quickly cut the rate of transmission of this disease and see that everyone receives service irrespective of wherever you are. So, if you get there, this test will be run, they will have to do this test again on you to confirm And if you confirm to be positive, you will enroll into treatment immediately. And this is the only antiretroviral drug that is a drug for HIV in Nigeria. Okay. And no other drug. Because you can see skeletal, you see people putting posters here and there, deceiving people. It's not working. It's just people that are looking away to defraud our people. And the agency frowns at it. It's not a good one, because, and even at times you see people saying that they've maybe a kind of, they no longer, maybe they did tests and they seem that test is negative, and maybe they come to churches, some come and say that they've had a miracle, that the HIV is gone. But at times what they achieve then is viral suppression, most of them. But I'm not disproving faith. I'm just trying to tell you a whole lot of people out there have been deceived. At times you see it as their viral load is suppressed. Because as a result of taking the drugs? Yes, because if you take it judiciously, following the instructions of the trained experts, medical doctors and healthcare workers at facilities, you see that the virus will be highly suppressed. But
if you still run a test, it will still read positive? Yeah,
depending. That's why we call it, say at that level, it's undetectable.
Okay.
Yeah, undetectable. You reports to you. So at that times, when people will come to church and do and maybe testify that they've had a miracle, and they stop taking this drug, and the thing will just bounce back immediately. And if you don't, if you're not careful, you resort to a full-blown ACE, because you've not been taking this drug and you see yourself in a very critical condition. So we advise people, even though you achieve that virus suppression, you need to stay on this drug. Wow. Okay. To sustain that virus suppression.
So you take the drug for life?
Yes, of course, it's life, and it's not. It's a very good one, and it has passed every test to be confirmed that it's very effective in suppressing HIV virus in the body system.
Now, you said something about no cure for HIV. What of this Abalaka? There was a case of Dr. Abalaka and some traditional herbal drugs saying that they do cure AIDS. Is it that because it doesn't conform with World Health Organization, those ones are being quashed or what?
Of course. We are talking scientists. We are being scientific in whatever we are doing. We don't just come out and start. Nigerians, I know we have regulatory organizations that are there, vested with authority of confirming, evaluating these drugs, and even WHO. Yeah. So we have standardized way of doing things, and for us, the agency, we don't even come out and start telling you about this HIV self-test for you to use it. It must have passed some level of evaluation and confirmation. So those ones we frown at it. It's not confirmed yet, and if you can recall, then how it generated noise here and there about it, and at the end of the day, it didn't survive. So people are advised to continue taking their HIV treatment, and these drugs are not gotten in the market. Let them get it from the facilities. So I will have there are many options and strategies where we reach out to PHIV, people with HIV, differential service delivery model. These these are models of ensuring that it's a patient-centered approach, ensuring that in any condition, wherever you are, you'll be reached with this medication. So it's working for us, and we cannot go back.
All right. Going by that saying that prevention is better than cure, I know that we all want a situation whereby this particular ailment is eradicated entirely. Just like you said, by 2030, we are planning to see that we don't even have a case of HIV/AIDS, maybe in Anambra State to start with. But now, I want to talk about the prevention of this ailment. Your contribution or the role you are playing in creating awareness, especially how younger generation, these young ones, how they are with when it comes to things they do and all that. So how are you creating this awareness and taking this campaign to them to teach them that, yes, I know that you need to get tested to know your status, but then for you to also remain negative is very important?
Of course. Prevention, they say, is better than cure. And we take seriously, we collaborate seriously with our young ones. You can see we have a roadwork today. A lot of people who will be participating in it are young ones. And we want, just like the theme of this year, community leadership to end by 2030. Communities leadership to end by 2030. Let communities lead. Every community members, especially the young ones, because they are in their active stage. So we have many organizations, CBUs that are working in Anambra State. Most of them are young ones. And they are being trained to take ownership of this response in their different organizations. For whatever we do in indigenous, we collaborate seriously with them. So it's not, just like I told you the other time, we have a MSM group, we have people who inject drugs, we have a transgender group, we have sex workers. Majority of them are young ones. Yeah. So that's why we work with them. And at times people will see it as if maybe we are promoting whatever they're doing, but we are not. We are trying to engage them from inside, because you cannot fight this scourge of HIV when you are somehow trying to make them to go into hiding. So you will walk along with them to get them. Our aim is making sure that they accept this intervention, take ownership, start doing whatever we are telling them. By the time they do it, because you don't know who may be involved tomorrow. So just like and the HIV prevention options we have is just like mother-to-child transmission of HIV, which is a very, very challenging way of HIV transmission. We have what we call prevention of mother-to-child transmission of HIV, which is ongoing in most of these facilities that are called. In that method, a mother who is positive, if she enrolls into the PMTCT, the chance that she will give birth to a negative infant is very, very high. So we encourage all our mothers, all our women there to make use of, to make sure that they do HIV test and enroll into antenatal care, ANC, which is offered free in Anambra today, because of our able governor, Professor Chukwumachi Asoludo. So we give kudos to him for creating that demand so that more people, the resultant effect is quite much now. We are getting good numbers of people who are enrolling into that ANC. Okay. And again, and we know we have what we call biometric capturing of PLHIV in Anambra State to ensure that data, because that, for everything we are doing, data is the key. Yeah. So that if one is positive here and you are captured in that biometric, data is there. In case you leave here and go to anywhere, once you put your information, you will know that your medication and quickly you'll be attended to.
Okay, so because that's the question I wanted to ask now when it comes to getting drugs, the antiretroviral drugs as a HIV patient, because you might have registered here in Oka and you have a need to travel to somewhere like FCT or Lagos. Yes. So can you still have access?
Of course, now, of course. We have a network, just like I told you. We have NEP1, network of people with HIV.
Okay.
We have partners. If you locate from here to elsewhere, that biometric information will probably tell that you are a PLHIV. So that to avoid you missing out or maybe missing taking your drug will be attended to, because your information is there. It's already captured.
Okay. And then before you now start receiving medication, do you need to do any registration? Do you need to pay for anything? Because we need to make it clear for people to understand.
Yes, everything about HIV services are free.
Okay.
Yeah, they are free. Even the medications are free. That's why we find people who go to buy these drugs in the market. They say they buy it in the market, and what they're buying is not put in a very right condition for you to access the drug. So we found that people should get it from our hospitals, our facilities. There, it's well conditioned. It's well conditioned for you to take it in the form it's supposed to be.
Okay. All right, just before we go, quickly tell us the activities you have planned for this year's 2023 World AIDS Day.
Okay, thank you. This is part of the activity.
Of course.
To campaign and tell our people to stay and they know that HIV is still with us. And we just had symposium. That was a day before yesterday. We had symposium. We had engagement here the other day. We had symposium on 29th.
All right.
And that symposium helped us to interact with community members and equally profile way forward on how to mitigate issues around stigma and discrimination. And equally awarded people who have contributed immensely in the field of HIV epidemic control in Anambra State.
All right.
A good number of them we are. And today we are doing a road walk.
Okay.
We're moving, and we equally have spots where we're doing HIV testing today free, and equally condom distribution, gender-based violence sensitization, and a whole lot.
All right.
So that's what we have. And tomorrow again, we had a press briefing yesterday with the Honorary Commissioner for Health, Dr. Afamobidike, who is equally doing great in HIV and helping us in achieving our epidemic control in Anambra State. And the next tomorrow we'll probably be engaging and in a discussion again with Aeon group in Anambra State.
All right.
Yeah. So,
all right, so well, on that note, we want to
church
say...
activities equally.
Okay. We want to say a very big thank you to you, John Bosco Ementa, for joining us on the show. The Director, Anambra State AIDS Control Agency, ANSACA. Thank you so much for being here this morning.
Thank you for giving me this opportunity, and I appreciate media. You guys are doing a whole lot. I appreciate you.
All right.
Thank you so much.
All right. Thank you so much. We are taking a short break, but we'll be right back. Stay with us.